Pivot the device around to use as either a pull or push transfer aid. For a pull transfer, place one foot on the unit's base opposite the patient to prevent tipping. There's no need to stabilize the device with push transfers, and hands can be placed with both the patient's hands on the lower bar, both hands on the higher bar, or one hand on the lower and one hand on the higher bar. If the transfer is in preparation for gait, a walker can be placed inside the S3 unit. In preparation of stand pivot transfers, S3 balance is ideal for pivot practicing. Patients who are non-weight bearing on one lower extremity often have difficulty trusting a walker to provide enough support for them to pivot on one foot. S3 Balance's stability and protected environment is especially helpful with patients learning this skill. If the knee block is necessary, it can be provided from either the front or side of the device. Walkers safely serve one function: assistance with walking. In fact, walker users' manuals often state that they are not intended to be used as a support with exercise, since they are lightweight, have a narrow base of support, and will slip with lateral forces. The S3 Balance, however, has been designed to provide stability with standing activities and exercise. The S3 Balance provides a stable support surface for patients to stand, whether you're assisting with grooming, such as donning pants and hygiene with toileting, instructing patients in posture and normalizing center of gravity over base of support, pre-gait activities such as sidestepping with turns, instructing in therapeutic activities such as reaching with weight shifts or balloon toss, or of course any of the S3 Balance movements for balance training, strengthening, and stretching. S3 Balance weighs 57 pounds and takes about 20 pounds of force to tip. It can be moved with either the wheelbarrow method or the hand truck method. Walk the unit in front and slow down around corners for extra safety. Also, storing the units with the open side facing a wall can prevent unauthorized use. S3 Balance is a new class of transfer aid. For patients who need help with bed mobility but are unable to reach the railing at the head of the bed, S3 can be positioned sideways at an optimal level.
To train the upper extremity when using S3 Balance, we're going to use the loops. So what Ann is going to do, she's going to tie a couple knots in a TheraBand, and the green type requires 2 knots. The higher intensity bands do not. And she's going to feed the TheraBand through the loop, and now she's good. She's going to grab one end